Okay, good day. So, ito yung topic natin, more on common board questions. Okay?
A limpid prevents cells from being host to more than one virus at a time. Answer: interferon. Inanimate objects such as soil, food, or water. Answer: fomites. Living carriers such as insects. Answer: vector. The container or place in which organisms grow and reproduce. Answer: reservoir. Is an enlargement of the male breast. The answer: gynecomastia. Is defined as experiencing abdominal pain during ovulation. Answer: measles MERS. Condition most frequently caused by gonorrheal infection or chlamydia. Answer: pelvic inflammatory disease. Removal of the testes. Answer: orchiectomy. Fluid collection in the space called the processus vaginalis. Answer: hydrocele. Infant: an infection caused by toxin-producing strains of Staphylococcus. Answer: toxic shock syndrome. Bleeding between menstrual period. Answer: metorrhagia. Absence of menstrual flow may suggest pregnancy. Answer: amenorrhea. Abnormal growth of extrauterine endometrial cells. Answer: endometriosis. Abnormally heavy menstrual flow. Answer: menorrhagia. Menstrual cycles that occur without the release of an egg. Answer: anovulation. In fetal milestone, when does vernix caseosa begins to form? Answer: 5th lunar month. Which of the following is common in a preterm infant? Answer: abundant lanugo. The following arises in the ectoderm: brain, hair, tooth enamel, except dentin of the teeth. The following arises in the mesoderm: kidney, uterus, cervix, except urethra. Fetal lung alveoli maturity can be achieved as early as 7th lunar month. Antibody transfer in the fetus happened as early as what lunar month? Answer: 6th lunar month. The mother asks you when will be earliest AOG that FHT heard through the aid of a Doppler. Your response would be 12 weeks. Still on FHT, again, the mother asks you by this time through the aid of ordinary stethoscope. Answer: 16 weeks. The portion where the trophoblast cells are establishing communication with maternal blood vessels. Answer: decidua basalis. The endometrium continues to grow in thickness and vascularity after implantation, which is called now as decidua. This is the cells in the outer ring that later becomes placenta and membranes. Answer: trophoblast. The following are the three processes of implantation: apposition, adhesion, invasion, except nidation. The term blastocyst brushes against the rich uterine endometrium is also known as apposition. It's described as a mulberry-like ball with 16 to 50 cells and its float for 4 days. Answer: Morolla. This is the enlarging cells that forms a cavity that later becomes the embryo. Answer: blastocyst. What is the usual amount of blood lost with cesarean birth? Answer: 500 to 1000 ml. Johnny reports in early labor she is not having much pain. You assess that her contractions are also not strong. What position usually promotes efficient uterine contraction in early labor? Answer: sitting or standing. If a patient develops a HELP syndrome, what symptoms would be most important to assess for? Answer: ecchymosis or petechiae. What is a goal of all birth settings? Answer: to have a safe birth for the mother and baby. The milk ejecting hormone is oxytocin. The milk producing hormone is prolactin. The greatest transverse diameter of the fetal head is the answer: biparietal diameter. The functional lifespan of the corpus luteum is how many days? Answer: 10 days. In doing breast palpation, palpate the areas of the central, lateral, subscapular, and pectoral nodes using your answer: flat parts of the fingertips. A clinical breast examination is recommended at least every year for women after 40 years. If a patient is diagnosed as having twin pregnancy, the following measures are acceptable: cesarean section, preparation for transfusion, hospital delivery, except limited physical activity. The FHT heard should be observed during uterine relaxation. If the posterior fontanelle is lower than the anterior fontanelle, the head is deflex. The type of pelvis with an almost circular inlet with wide pubic arch and curved sacrum is answer: gynecoid. General anesthesia together with the following drugs except oxytocin are used for uterine relaxation and repositioning postpartum uterine inversion: Retrodine, magsulfate, and terbutaline. The term applied to external organs from mons to perineum is labia majora. In cephalic presentation, it is a blank presentation when the orbital ridge and anterior fontanelles presents. Answer: bro. If a woman was operated for breast cancer, the following relatives must be screened for a breast cancer, except in-laws. The method of contraception which inhibits ovulation is answer: pills. Breastfeeding exerts a contraceptive effect as it increases the mother's level of answer: prolactin. Amniocentesis done at third trimester help determine which of the following? Answer: maturity of fetal lungs. Tetanus is acquired by the neonate by means of the following. Answer: unsterile instruments. A baby who developed noisy breathing on respiration, marked retractions of the chest wall, flaring of nostrils, and barking cough, the most likely diagnosis is tracheobronchitis or viral crow.
Okay, thank you. Thank you for watching. Please like and subscribe.